Hey, future nurses, are you stressed about getting your license? Here at ReMar Review, we believe in faith over fear. I'm Regina Callion, the #1 NCLEX instructor in the world. Tune in to ReMarNurse Radio on Spotify and Apple Podcasts for new episodes every Thursday. We got that exclusive content. You don't want to miss it. We can, we will, we must pass NCLEX. Hey, ReMar nurses. This is the place to be for any nurse that's studying for NCLEX. We like to call this very special segment here at ReMar Review. We like to call it Motivational Monday / Let's Talk NCLEX. It's the place to be, and I'm so glad that you are here with me. My name is Regina Callion, but before I go into that, you know, one of the most exciting things about being on this NCLEX journey is having a partner to study so that you're not alone. And here, you have the family, you have the support. I love it. Monday motivation / Let's Talk NCLEX. Come on in, there's hundreds of people. Yeah. We're going live from YouTube today. Facebook got to hop over. It's YouTube broadcast only, and that's okay. If it's your first time with us, my name is Regina Callion. I just happen to be the #1 NCLEX instructor on this planet, and I'm here. Good morning. I know Florida's in the house, Philippines. Shout out to all the ReMar nurses, India, Nepal. We made it here. We made it through another weekend, and we are happy to be here. So you know what? You have the goal of passing NCLEX. You have the grind. Now you just need the motivation. And today's motivational topic, it's a good one. Good morning. Listen, and if you're here for your first time, you are going to be so excited to be a part of this because this is going to start your week off right. I promise you. Yes, I know. This is what you've been waiting for. The topic today, though, is a great one. It is the rent is due. The rent is due. Oh, you're going to like this one. It really touched me, so I had to share it with you guys. Shout out to Winning Wednesdays. We have been going strong for 2 Wednesdays, and this week is our last Winning Wednesday, where we have been going over my favorite book, your favorite book, Quick Facts for NCLEX, the 5-star version, the latest edition. You can get this book, ReMarNurse.com, because it is for every ReMar nurse at 9 a.m. Facebook study group. We go over the goodness of this book. And if you've missed the last 2 Winning Wednesdays, fear not, because part 3, the final part of the 3-part trilogy series, is this Wednesday. And we will be going over the pharmacology, the skills section. I'm going to go over the entire book. So, well, I digress. Not the entire book. I can't say the entire book because how can I go over all of this goodness in just 3 Wednesdays? I'm going to go over sections from any section from the book. That's what I wanted to say. To clarify, anything that is in this book is up for question this Wednesday. So if you have the book and you don't know if you really know it the way you're supposed to know it, Winning Wednesdays will determine that, because there is nothing like studying Quick Facts with me, because I challenge you guys. And so this week is going to be very challenging. I already started preparing for the class. I got pictures. I'm going to show you a picture and say, what is this? And you have to know what it is. It's going to be very fun. So anyhow, this is Winning Wednesdays. We doing it. And the ReMar Nurse Facebook study group, there's over 20,000. There's over 20,000 blessed nurses in that group preparing. Don't miss out our opportunity to study this book. Hey, shout out to everybody. Good morning. It's a wonderful day. It's a wonderful day here at ReMar Nurse Company. I love it. All right. So the rent is due. What is that about? I'm going to give you your motivational word, and we're going to get right into it. Okay. Get in your Monday. I'm giving you the word, and then we're going to get right into the NCLEX, right? And we're going for shares. We're going for comments. We're going for likes, and I just love to see the feedback that these videos produce. So the rent is due. What are you talking about, Regina? What are you talking about? Listen. This is a very powerful statement. Most of you guys know what it's like to rent something. You know what it's like. Like, the rent is due. When you think about rent, rent is something that has to be collected on a time interval, right? You know that every so often you have to pay rent. Rent is something you pay. Are you guys tracking with me? Are you following with me? Rent is your obligation. It is something that you have to agree to the terms of. And that's what I need you to understand today. When you are doing this NCLEX journey with ReMar, you're agreeing to the terms of the contract. And it's such a powerful connection when you talk about paying rent. When you talk about paying rent, it's very powerful because when you rent something, it is associated with a temporary condition. Did you catch that? When you rent something, it means that you only have that thing for a short amount of time unless you continue to pay the rent. Unless you continue to make the payments, the thing is taken away from you. This is our motivation. I need you to get that in your mind because listen to this. Success, the success that you want is never owned. It is rented. And the rent that you have to pay is due every day. That's it. That's the thought. Listen, you guys want success, you can have it, but you rent success. You never own it. And in order for you to keep that temporary thing, you have to pay rent on it every day. That's the challenging part. Normally when you pay rent, you pay like every 30 days, you pay, every 6 months. No, when it comes to success, when it comes to being successful in your life, it will require you to make a payment every day. There is something that you will have to do in order to keep that success. There's no way around it. And I'm not going to sugarcoat this for you guys today. The rent for you guys, and the rent is due today. The rent for you guys is hard work. It is sacrifice. It is studying consistently. It is learning new things. It is eating right. You got to like this video. I need to see that. I need to see that subscribe button for you guys. It's eating right. A lot of you just eating right, right? Eating right, exercising. All of these things are part of your payment plan for success. You are not going to get there. You're not going to get there if you haven't put in the hard work or the sacrifice. If you're not studying consistently, the rent requires you to eat right. You cannot eat what you want to do and have a clear mind. You cannot do it. You have to scrutinize everything and think about, is this me paying the rent, or is this me not fulfilling the obligations that is required? Okay? Is this me paying the rent today, or am I becoming delinquent in my payments? And some of this, and this is for somebody. This is for somebody who has given up, who has become totally delinquent. You become totally delinquent in paying the rent. You're not doing any of the things that's required to get that success. You're not keeping it. They have repossessed the success because you have not been making the payments. And so for Monday motivation, this is an opportunity for you to, I like that, keep pushing. This is the opportunity for you to schedule your payment plan, right? I'll put you on a payment plan. I'm putting you guys on a payment plan this week. Every day, you are going to pay your rent, and you are going to get caught up where you have been delinquent. Some of you guys, you have the whole program. You have the whole ReMar program, but you are not studying it consistently. You have that 6-week calendar. You were supposed to have your license the beginning of August, but now you're starting over again. Okay? And that's okay. But the idea is that today you make the determination that you're going to get back on track with your payments. That's it. So You will not stay successful even if you're able to achieve just a little bit of success. You will not keep it if you don't do these things. You will not keep it if you neglect these things. I'm not going to beat a dead horse. I'm not going to, I'm going to get off this. I'm going to get off this and move on. But you guys, remember, you don't have the option to buy your success. You are a permanent renter. You are a permanent renter for life. So you guys are in this thing with me, right? I'm out here grinding every day, not because I like to do it, but because I must do it, right? I'm on the can. I did the can. I can do it. I will do it. But now I'm at the must, right? I'm at the, this is what I must do. I must grind at this level if I want to be the number one NCLEX instructor on the planet. I can't take Mondays off. I have to make sure that I have a word. I have something to motivate you guys with. So I like that. Hashtag consistency brings success. Hashtag pay the rent. Pay your rent. You got to stay focused. You got to stay focused. I love it. I love it. So I'm enjoying the comments. If this speaks to you, go ahead and put a comment down. I like that. I was a delinquent. Somebody said I was in the rears. I was in the red. They had repossessed. I don't want anybody to repossess your chance to get your license and pass NCLEX. It's yours. You guys are right there. You've already done all the hard work. I can't say it enough. You have paid the payments over and over and over again. Don't wait to the end and then become delinquent. We can't do that. We can't. All right. So hashtag consistency brings success. Pat, pay your rent. Pay your rent. Now, let's go. Are you ready for Let's Talk NCLEX? Oh, yes. Oh, yes. Let's Talk NCLEX. My favorite time to spend with you guys. And you know what? I just have to tell you guys that the questions, we have sponsorship by Let's Talk NCLEX. And today's sponsor is the NCLEX Ready Question Bank book from ReMarNurse. I took the questions in today's Let's Talk NCLEX from this book, the RN version. I do have a PN version as well, but the RN version is what I used from this for today's episode. So if you enjoy today's episode, you may enjoy this book. But remember what I say. I only want to see you doing questions. I only want to see you doing questions after you have studied the content, not before, but after. Not before, but after, because these questions in these books, I love them. I love the questions in this book. This is actually an answer sheet. But I love the questions in the book because they help you to see if you understand certain elements of the content. But this book will not teach you content. No. No question bank book, online or physical, is going to teach you that content so that it makes sense. What it will do is it will allow you to evaluate, hey, do I really know it? Do I not really know it? That's all. So this is done after you've done the 6-week challenge. Then feel free to do questions, all right? So we are going to do some questions right now because it's going to motivate you guys to study and pay the rent. So here we go. Hey, as I said before. All right, so we have 5 NCLEX questions. Smash that share button for you guys on YouTube. Smash that subscribe button to unlock all 8. Oh my goodness. So there's actually 8, but we'll see if we can get to, we can just at least do the 5. I want to see how you do. I'm looking for 3 out of 5 here. For our first 5, I'm looking for 3 out of 5. Can you guys get 3 out of these 5 questions correctly? If you're a PN, absolutely. Come on in, answer these questions, because you know what? One thing about, and I love to have the PN study with the RNs, because the PNs, you're not only expected to know your scope of practice, but you have to know what the RNs can do as well, so you don't cross into their scope of practice. And the RNs, you have to know what the PNs are doing, because you delegate to the PNs, right? You delegate, you can assign to a PN. So it's a beautiful picture when the PNs and the RNs come together in a respectable way. They value the contribution of the other discipline, and they work together to provide excellent care. I don't know what it is about nursing where there's this ego hierarchy that, like, if you're an RN, you're better than a PN. If you're a PN, you're better than the nurse's aide. No, actually, everybody's the same. You just have a different set of skills that you're bringing to the patient, but you're no more or no less valuable than the other peer. And I think that's the real issue. Well, why we're in such a nursing crisis right now, because in the 70s, they didn't value nurses, and they thought, well, why do we really need nurses? Why do we really need them? Why can't we just have, medical assistants or physicians to do this work? This group of people, yes, it's nice to have, but they're not necessary. And so they begin phasing out registered nurses, practical nurses. And then now look at us. Look at us 30, 40 years later. We are in a crisis because we have not valued what nursing brings to the table on all levels. It's a shame. It's a shame. All right, but that's not what you guys came here for today. You came here for, you came here for these NCLEX questions and this motivation. Here we go. Question number 1. I just need the answer. I'm looking for 3 out of 5 correct. It says, which of the following can reduce a client's post-surgical pain and anxiety? Here we go. Number 1, preoperative medication. 2, physical therapy. 3, preoperative teaching. Or 4, group therapy sessions. Here we go. Which of the following can reduce a client's post-surgical pain and anxiety? 1, preoperative medication. 2, physical therapy. 3, preoperative teaching. 4, group therapy sessions. Oh yeah, here we go. I see you guys participating. These answers are rolling in. Actually, you are doing quite well. No. This isn't a select all that apply question. There is only one true answer. There is only one right answer. And let me show you what that answer is. Shout out ReMarNurses for participating. The correct answer is POW. Preoperative teaching. This is so valuable to our patients to reduce that post-surgical pain because it's going to reduce the anxiety. The patient will know what is going on, what's going to happen. The patient will understand, okay, this is the process. This will be available to me. And it's going to really, really help your patient to have less anxiety, less fear. All right. So I'm not working from a specific workbook. These questions come from the NCLEX Ready Question Bank book. So we're just doing various questions out of here. All right. Here we go. Did you get it right? All right. Next question. We're on a roll. We're going to keep on going. Next question. A nurse is preparing to administer blood to a client with a hemoglobin of 7. The nurse notices that there is a small air bubble in the bag of blood. Which is the most appropriate action of the nurse? Number 1, send the blood back to the lab. 2, notify the healthcare provider. 3, allow the blood to infuse via the filtered tubing. Or 4, report the incident to the charge nurse for clarification. All right. I know I got to shout out to the nurse. I just want to jump in here. Shout out to the nurse who just passed. Let us know that you passed. Congratulations. Thank you. She said ReMar is the real deal. We celebrate you for coming back on and making us aware that you have your big license now. Send us your video. We want to see it. Here we go. So the nurse notices that there is a small air bubble in the bag of blood. What is the most appropriate action by this nurse? The answers are all over the place. Number 1 option, if you notice a small air bubble in the bag of blood, you need to send the blood back to the lab. Number 2 says, notify the doctor and say, there is a small air bubble in this bag of blood, doctor. What do you want me to do? What about 3? Allow the blood to infuse via the filtered tubing. Or 4, report the incident to the charge nurse for clarification. Ask the charge nurse to help you out. I see the answers. Oh my goodness, they're between 1, 2, 3, and 4. I see every one of those answers. How could it be? I don't know. Let me show you the right answer, and it is allow that blood to infuse. Yes, you do, because guess what? You are using filtered tubing, and that filtered tubing specifically has the purpose of catching small air bubbles. Don't give me the angry face. Don't give it to me. You got to remember filtered tubing, all right? All right, so yes, the filtered tubing will definitely catch that air bubble. And again, it's a small air bubble, so it's not like it's a large air bubble. I mean, if you saw particles floating around in the blood, if the blood was not the correct temperature, then these are reasons that you would send that blood back to the blood bank. But for a small air bubble, you're going to just run that blood because the patient really needs it. The hemoglobin is what? The hemoglobin is 7. So that's pretty low. That's pretty low, right? Patient needs that blood. Here we go. All right. Question number 3 says, a client who has diabetes mellitus has been on insulin for 2 months. After a 3-day hospital stay, the client is discharged. At 9 a.m. after breakfast, the client calls the health clinic and states, I'm feeling weak, but my glucometer is broken. I tested my urine and there are no ketones. I just had a morning jog. The nurse determines the client has taken his normal amount of insulin. Which of the following interpretations is most accurate? This is an RN or a PN question right here. Number 1, the client should increase their morning activity. 2, the client's experiencing hypoglycemia. 3, the client's insulin dose is incorrect. 4, the client's insulin levels are normal. All right. What sayeth you guys? I see the answers coming in. If I break down this scenario, a patient, the patient is been on insulin for 2 months, so that's relatively new. 3 days after a hospital stay, the client is discharged. Okay, that's not really significant to us now, but at 9 a.m. after breakfast, so the client has eaten, the client calls the health clinic and says, I'm feeling weak, but my glucometer is broken. I tested my urine and there are no ketones there. I just had a morning jog. So we know that what does activity do? What does activity do to the blood glucose levels? Will activity bring those blood glucose levels up or will it bring it down? Yes, that activity is going to bring that blood sugar down. And then on top of that, the nurse determines that the client has done what? They also took some insulin. So the insulin as well is going to bring that blood glucose level even more down, like, right? Decrease it even more. So in all of that, we can determine just by that this client is experiencing hypoglycemia. Okay, so the client is experiencing hypoglycemia. So that's just something. Now, this is a great question where there's really no strategies that could have helped you figure it out. Like, it's strictly about the content. You have to understand the relationship between exercise and also the blood glucose. Okay, you have to understand that. So this is a really good example of knowing your content. Okay, here we go. Medications are classified according to which features? Every nurse should know this. Every nurse should know this. Medications are classified according to which features? Number 1, actions. 2, names. 3, therapeutic uses. 4, side effects. How are medications classified? Oh, okay. So this is a tricky one. All right. This is a tricky one. What say if you guys? Think about how we study them. Think about how we study the medications. Okay. I'm letting you guys, I am letting you guys think about this, and I see the answers coming in and they're all different. So that means that this may not be common knowledge, right? This may not be common knowledge. So I am glad that you guys are studying with me today. I'm glad that you guys are studying with me today. All right, ReMarNurses, let me give you the right answer. Medications. This is pharmacology 101 right here. Medications are going to be classified by, their therapeutic uses. So drugs are classified according to their effect on a particular body system, their therapeutic effect, and the chemical characteristics of the medication. All right. So you need to know that when you're studying. And I also, when I'm studying pharmacology, I do like to study them in the context of the body system that they have an effect on. That's how I want you to study your medication. So if you're looking at the GI tract, you need to study all the medications that work on the GI tract. Don't be studying medications from all over. Make it easy on yourself. Just make it easy on yourself. That's all I want to say. That's all I want to say. I don't want to belabor that. Make it easy on yourself. Here we go. ReMarNurse strong. How many did you have? All right. This is question number 5. Here we go. Up. Smash that subscribe, share button to unlock all 8. We got 430 nurses right here, right now. Wow. All right. We want to have, so how many? We got what? 46 likes. Oh, 46 thumbs up. That's not good. That's not cool. We got over 400 nurses watching. I need everybody to smash that thumbs up button right here. All right. We got to at least have, look, I see it climbing. We got to at least have 200 thumbs ups. That's it. Period. If y'all want to keep going, we got to at least have 200. We got 60 right now. Unacceptable, ReMarNurses. Smash that thumbs up button and the numbers climbing. I'm going to do question number 5. And then we'll see how far we can get. We up to 90. We up to 90 right now. All right. Question number 5. Last question, unless we get to 200. Big thumbs up. Hey. All right. Here we go. Question number 5. A nurse is working on a pediatric unit. A child comes in with a persistent headache. The child is 5 years old. What sites are best for IV placement? Select all that apply. Select all that apply. Here we go. Number 1, hands. 2, carotid vein. 3, antecubital fossa. 4, scalp. 5, wrist. Here we go. Select all that apply question. I need the thumbs up button on the video, not in the comments. All right, here we go. Select all that apply. You wanted a tough one. Here it is. We got 116 thumbs up. We need 200. We still need 200. All right. So we're talking about a select all that apply question. Select all that apply question. And we're talking about when you have a child that is 5 years old, where is the best place for IV placement? I see 1, 2, and 5. I see just 3 and 5. Nobody's picking 4. Nobody's picking 4. Oh, a couple people pick 4. What say if you guys, I got to move on. We didn't quite make our goal. We're at 124. So I'm going to give you the answer to this last question. And the answer is, Here we go. Just 1 and 3 here. Just 1 and 3 for the best placement for a 5-year-old. Back of the hands in the antecubital fossa. Back of the hands in the antecubital fossa. The carotid vein, no, guys. No. That you would never put anything in the carotid artery. Number one, you're not going to do that. And then the scalp, that's more so for babies, right? We put them in the scalp. Yeah. Wrist. The problem with the wrist, as opposed to the back of the hand, the problem with the wrist is that in general, when you have an IV in your wrist here or here, it's very painful, and it's easy for the veins to do what? When you have veins here, they tend to roll. You ever heard of a rolling vein? Like they don't stay in the same place. So it's easy for you to lose the integrity of your IV when you put IVs there. All right. So we only got up to 130 thumbs up. All right. We needed 200 to continue. So we won't be able to do our questions. Oh my goodness. We are almost there. I'm going to give you guys like 2 seconds to smash that thumbs up button. We are only like 70 away. There's 460 of us. So let's do it. While you guys try to attempt to get 200, we're at 134. Let me tell you this. Don't forget, we will be studying the 5-star quick facts. We can use the code WIN WIN if you want just a $20 quick fact. Some of you guys have the original. Make sure for the updated version of this book that you have the 5 stars on it. We call it the 5-star quick facts. Make sure that you have this version for the most updated information. And people ask me all the time, it's 9 a.m. Eastern time. Yeah, in the group. And we will be opening up the Facebook group. We check them all the time. We check the people that want to get in the ReMarNurse Facebook study group all the time. So you will get in. Make sure you answer those questions because there are entry questions. I got to say that. There are entry questions in order to get into that group. So people ask all the time, what is the difference? What is the difference between the original 5-star and then the original and the 5-star, the one that doesn't have the 5 stars on it, because people are still buying that one off of Amazon. The 5-star quick facts has the additional 17 new topics. Also, it has, both of them have the pharmacology section, but the 5-star has the skills section as well here. So the top skills you want to know for your NCLEX exam, this is super important. Also, what I did was I also did the pharmacology section. I did redo the pharmacology section in this book. So if you have the pharmacology section, I took out all of those brand names and there's only the generic names in this book. So this is super important for you guys studying pharmacology. These are the top 100. I think there's like 120 here because I added the cancer medications. I added some new medications in this one. So I took out the brand names. I focused more on the teaching. In this book as well. So we're going over this book on Wednesday. I also did some next generation NCLEX questions. You know, the NCLEX changes that they're trying to do. So when I went to the NCLEX conference, they gave us previews of the type of questions that they were going to be looking into creating. So I put the next level questions here, just the different examples of them. So if you have the 5-star, you see the kind of questions that they are. They're going to try to do they're going to be doing like matching and definitions and radio questions and these type of chart questions that they're looking into doing. So make sure that if you don't have this book, that you get it, because we're going to be studying it Wednesday right here. This is our last week Thank you guys for saying you love it. Hey, we got 170 thumbs up. We got on this video. Amazing, amazing, amazing. You guys are almost there. Count down to 30. Let's go. I'm trying to stall as much as I can if you guys see it. So yes, I like that. If you purchase it, you won't be disappointed. And it is on ReMarNurse.com, ReMarNurse.com. Let's go, you guys. We're almost there. I want to show you guys these last couple questions. I think you'll enjoy them, but it's up to you. You know, it's up to you if you want to do them or not. I don't know. I can't say. All right. Okay. Can you guys do it? Are you guys almost there? They're really close, Mark. They're really close. What do you say? Mark?
They're not sure how to do it.
They're not sure how to do it?
Yeah, some people are new to YouTube because they've been on Facebook.
Oh, if this is your first time on YouTube. Oh no, so you have to go to the video. You just have to
exit out of the chat.
You have to exit out of your chat, and on the video, you have to smash that big thumbs button. So somebody said, hit the X in the corner, go to the video, smash that thumbs up button, and smash that subscribe button if you're not already subscribed. Because as you can see, Facebook, listen, when Facebook gives us issues, we got to abandon Facebook and we got to just turn it up on YouTube. I got to start focusing on the YouTube channel because YouTube doesn't give us any problems. Very rarely do we have issues with YouTube. So Mark is showing me. So on the video that you guys are watching, wow, this is me. This is me watching me on YouTube. That's pretty cool. So right underneath, there's the option. Smash it. Okay. Anyhow, YouTube is the best. Somebody said YouTube is the best. I don't have Facebook at all. You guys got it. Congratulations. You did it. You worked together as the ReMar community. You got 224 big thumbs up on this video. You did it. Yeah, we can keep going. I'm so excited about it. This is Unlock question number 6. Here we go, ReMar nurses. Mr. Johnson, a 52-year-old feeble male with a history of drug abuse, malnutrition, and congestive heart failure is returning to the healthcare provider's office. His return is 12 days after being on a new medication to control his congestive heart failure. Question number 6. The nurse should begin the assessment by doing which of the following? 1, collecting subjective data. 2, collecting objective data. 3, taking the client's vital signs. 4, collecting subjective and objective data. Here we go, ReMar nurses. Here we go. Here we go. All right. I see question answers rolling in. I see 3s. I see 4s. How you doing? Philippines in the house. I love it. I love it. Florida in the house. I love it. Answering questions from all over. Is Jamaica in the house? Puerto Rico. What's up? All right. Questions coming in. I probably got Nigeria in the house. Kenya. All right. Trinidad. I love it. ReMar nurses, we over the map. Here we go. All right. So questions coming in. Questions rolling in. The correct answer, if you didn't know, is all right. It is number 4. Remember, nurses, when you're doing that interview, shout out Trinidad, includes the physical assessment, laboratory data, diagnostic test reports, but it's collective subjective and collective objective. All right. Both. Here we go. Got to keep going. All right. Collecting what you see and what the patient said. I love that. Thank you guys for helping me with that one. Your comments are what make this video what it is, period. You guys, I cannot do this by myself. I need you guys here helping me teach this thing. Question number 7. Here we go. Haiti in the house as well. I love it. 7. A float nurse is working on a maternity unit. Which of the following information is most important to determine the current state of labor for a prima gravida? Here we go. Number 1, the number of weeks pregnant. 2, the frequency of contractions. 3, the blood pressure. Or 4, the fetal heart rate and tone. United Arab Emirates in the house. Wow. Thank you for being here. Number one, we are talking about what is the most important information to determine the current state of labor for prima gravida. Woo, this is one of those questions, basic questions. Are you 7 out of 7? Is anybody 7 out of 7? The number of weeks pregnant, 2, the frequency of contractions, 3, the blood pressure, 4, fetal heart rate and tone. You have unlocked these last 3 questions. This is question number 2. All right, and remember, this is a learning activity here in terms of, do you know about this topic? So if you get it right, hey, that's excellent. If you don't get it right, we just need to revisit this again. It's no worries. No worries. We just need to revisit the topic, and I know what I need to come back and study for you guys, right? The correct answer here, shout out all the countries represented. All right. Best way to determine how labor is going along is the frequency of the contractions. Yes, that is going to tell you if your patient will be delivering today or not, if your baby is on the way or not. It's a simple thing, but NCLEX is very great at distracting you guys, right? So you see something like, number 1, the number of weeks pregnant. Well, isn't that significant? Isn't that? Yes, it is, but that's not going to tell you if the baby's coming or not. The blood pressure of the patient, no. That's not going to tell you either. And fetal heart rate and tone, well, those are great things to know, but they will not tell you the progress of labor. So you guys, keep it simple in that way. Like NCLEX questions, they don't have to be all elaborate to be difficult. Quite honestly, I find that you guys get the difficult ones right and the easy ones wrong. I don't know how you do it. It's an amazing skill, but the easiest questions you guys will get wrong. And then I'll challenge you guys with a difficult question and you're like, oh, that's too easy. So literally, it is the fundamentals that keep you in the game, okay? That keep you in the game. So we're talking here about the current state of labor, okay? The current state of labor. All right, here we go. Last question. Are you guys enjoying this? Are you guys having fun? I am having fun. We are moving on. We've been studying for almost an hour. Yeah, that's how we get down here. All right. Number 8 says, the nurse is caring for the following clients on a medical unit. Which client should the nurse assess first? Here we go. This is prioritization at its best. Number 1, the client with, and don't say this is easy. This one is hard. Here we go. Number 1, the client with disseminated intravascular coagulation who has blood oozing from their wound site. 2, the client with benign prostatic hypertrophy who is complaining of frequent dribbling of urine. 3, the client with diabetes mellitus who is complaining of severe flank pain, fever, and has hematuria. 4, the client with Cushing's syndrome who has a potassium level of 3.0 and hyperglycemia. Here we go, ReMarNurses. I got your priority right here. Prioritization at its finest. Who are you most worried about? And guess what? You don't have airway breathing or circulation here. So what are you going to do? What are you going to do? Somebody says, I'm torn between 1 and 4. I just don't know which one it is. I like that. Which client is the priority? Come on, we want to finish strong. We want to finish strong. So we want to get this one right. This is what you came here for. You came here to be challenged. You came here to be challenged. And so I'm challenging you with this last one. I'm going to show you the answer in a minute, but I want you to commit to one. Don't post 2 answers. You can't do that on your NCLEX exam. Don't do it here. Okay. All right, I see the answers. I see the answers. A lot of ones, a lot of threes. We're going to break this down. Once I reveal the answer, you guys will say, oh, I never should have doubted her. I never should have doubted her when she said she was the number one instructor. Here we go. The correct answer is going to be client number. You had it right if you pick client number 3. This is your priority patient. And let me tell you why. For everybody that picked number 1, okay? Yes, for everybody that picked number 1, well, what does this patient have? They have DIC. And with DIC, what is the issue? The issue is bleeding. You're going to have problems with the blood clotting. So to have a patient with DIC who also has blood oozing from their wound site, am I going to call the doctor about this? No, I'm not, because the doctor is going to say, yeah, I know they have problems clotting their blood. So it is not abnormal for them to be oozing blood from their wound site. What about number 2? All right. Is 2 our priority? I don't think anybody picked 2 because you understood that with BPH, you have these kind of signs. You're going to have the frequent dribbling of urine. Your patient's not going to be able to clearly empty their bladder. They may have some painful urination, right? So kind of the signs of a urinary tract infection you will see with BPH. Not your priority. And number 4, too. Number 4, yeah. I'm not even going to say it, Tiffany. All right. So number 4 as well. This is an expected finding. People with Cushing's syndrome, don't they have a low potassium? Doesn't that potassium leak out? Yes, it does. Signs of Cushing's syndrome. Isn't their blood sugar high? Are we going to call the doctor about this? Are we going to make this a priority patient? No, we're not. Not at all. Some of you guys did, but we're not going to do this for number 4, right? Number 3 is a priority because a client, don't be so insecure. Don't do it. The client with diabetes mellitus, we don't expect that patient to have hematuria. What's hematuria? That is bleeding. That is blood in the urine. Why do you have that? Why do you have a fever? Why are you having severe flank pain? I am not expecting you to be going through these types of changes. I don't expect you to be going through these kinds of changes with diabetes mellitus. You have some abnormal clinical manifestations and you need your assessment done right away. So I like it. So remember here, the idea is that airway, breathing, circulation is not always going to save you. You have to be able to understand the disease processes of the patient. You have to be able to understand who is going to be the most severe. So somebody says the sequence. So my sequence, if I had to sequence these from most to least priority, I would do 3. And then I would go to 4 because they have the low potassium level, and a too low potassium level can cause what? It can cause my patient to have some cardiac dysrhythmias. Also, the hyperglycemia. I don't know what the blood sugar is. Hyperglycemia is less of an issue. Like you can have patients with blood sugars. I've had a patient with a blood sugar of like 1400. So the blood sugars can go very high. I think the biggest issue with hyperglycemia for me is the dehydration, because dehydration can cause your heart to do funny things too. So I would see that patient with Cushing's syndrome next. And then I'm probably going to go to between 1 and 2. I would go to 1 because they have blood oozing from their wound site. So I need to check the integrity of that. I may need to reinforce that wound site. I may need to get an order for vitamin K to get the blood clotting. I don't know, right? I just know that patient needs some more assessment, and then 2 last. So what do you think about that? Do you guys agree with me on that sequence, or would you do something different? I want to know. All right. So, hey, you guys, you know what? You guys had an amazing study session with me today. I don't know if you like it or not, but I had so much fun. I had so much fun for this Monday motivation / Let's Talk Wednesday that I don't even want to end it. But I must, because I promised that I don't keep you guys longer than an hour unless I'm doing a specific event, which I'm not right now. But hopefully soon in the future. Oh, I know, it will be in the future. On Wednesday, I will be doing another study session of the Quick Facts book, kind of in the same fashion. Don't forget, this is a major announcement. Don't forget about the giveaway that I've been talking about literally for weeks now. We are giving away a cruise for 2. Yes, the cruise for 2. And I am super excited about this cruise because it is our thank you gift for one amazing ReMarNurse who has passed NCLEX. We had somebody on her today. Passed NCLEX. All you have to do is send in your testimonial video. Literally, that's it. And we're picking one person from that who we are going to take on a cruise. It's a ReMar cruise. We're going to take them on a cruise. We're going to pay for them to go on a cruise. Not only themselves, but who wants to go on a cruise alone? Nobody. Nobody wants to go on a cruise alone. So we're going to take you and your friend, whoever it is, your friend, your mama, your daddy, your son, your daughter, whoever, me, you can take me. Okay, I might be reaching there. You can take somebody else with you. We will pay. We will pay for you two to fly. We will pay for you two to get there. And we're going to give you $500 to spend on your cruise as well. And so literally all expenses, an all expense vacation, because you guys deserve it. So all you need to do is send in that testimonial video. We want to see you. And then finally, I just want to say thank you, ReMarNurses, for just, I don't know, for just being with me, for just taking a chance. I mean, you guys are taking a chance on an unknown girl, right? I'm just a small town girl with a big dream. And you guys are giving your attention, your devotion, your studying with ReMar Review. And we really appreciate it here. We are a small company, but I'm telling you guys, we are making an impact in NCLEX. And I'm literally, we're going to the top, and not just us by ourselves, but we're literally taking you guys with us, and you will be at the top as well. ReMarNurses, we are making it happen right here every day. Remember, today your rent is due. Today your rent is due, and you have an obligation to pay it because nobody's going to pay it for you. Questions or comments, emails, how do I do this? What can I do? Support@remarreview.com. We love to hear from you. I want to know what is going on. What do you need? Let me know how we can help. And don't forget, no matter what, we always say, we can, we will, we must pass NCLEX. Gotta say it again in case you missed it. Everybody all together. 1, 2, 3. We can, we will, we must pass